Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Judith Borger.
Hello, friends, and welcome to episode 64 of the Aesthetic Doctor Podcast. Are we really already on episode 64? This is amazing. This is Dr. Borger, and today's episode is entitled, Does Skin Color Matter in Aesthetics? So before we get going with this episode, I'm going to give you my disclaimer. I am a white woman, which I know is a privilege. So this is an attempt to educate about the Fitzpatrick Skin Type Classification and how it applies to aesthetic medicine, and why and how it is of utmost importance that your provider understands how different skin types and different skin colors react differently to certain treatments that they may provide in their offices. So, going back to the question, does skin color matter in aesthetics? And it's a yes and sort of answer, right? So, skin color does matter in aesthetics to the extent that not all treatments are safe or appropriate for all skin colors and skin types. And what that really means is that some treatments are, quote, colorblind, end quote. So meaning that they can be performed on all types and colors of skin. Examples of those treatments are Botox, are fillers, are facials in general, right? Like hydrofacial and oxygen facial. So for those treatments, skin color doesn't really matter. However, especially for energy and light-based treatments, for lasers, the degree of color or pigment in your skin matters because skin with different degrees and types of pigmentation will react differently to those treatments, which means that because there's risks of burns, of scars, of hyper or hypopigmentation, meaning patches of darker skin, patches of lighter skin, not all treatments are safe and appropriate for all skin types. Or even if we can use the same sort of device, the settings for the device have to be changed and adjusted based on the color and the type of your skin. For those types of treatments, skin color absolutely matters. In my office, Concierge Medical Arts in Fayetteville, North Carolina, we attempt to practice inclusive medicine, which for me is really to create a culture of belonging and a culture of safety. And for me, that also includes that all of my practitioners have the scientific background and knowledge to use the appropriate treatments for all different skin types and to use appropriate settings for different skin types. And in my office, we do carry alternative treatment for, let's say, darker skin types. One of the treatments you guys know I absolutely love is IPL. However, that is a prime example of a energy-based treatment that is only appropriate for certain skin types and not all. But then let's say we have the Tixel, which is a great alternative treatment because it's safe for all skin types. So if you have darker skin and you're not an appropriate candidate for, let's say, a rejuvenation with an IPL or treating some hyperpigmentation, we can offer you the Tixel treatment, which is safe and appropriate for all skin types. And another example is we carry not just one peel, but we carry a wide selection of peels so that we can provide appropriate chemical peels for all skin types. I've talked a lot about skin types right now, and let me just kind of tell you what we mean most often in aesthetics and dermatology by skin types. The most commonly used skin type classification system based on skin color is something called the Fitzpatrick Skin Type Classification. Fitzpatrick Skin Type is a classification system that basically categorizes human skin color and its response to ultraviolet or UV light and radiation. It was developed by Dr. Thomas B. Fitzpatrick in 1975, and it is widely used in dermatology and aesthetic medicine to assess the risk of sunburn and the likelihood of tanning. And a lot of times still when we train on devices, when we assess patients, we use this Fitzpatrick skin type system. The Fitzpatrick skin type system was named by Dr. Fitzpatrick, of course. And I think that always like old white guys in medicine, it's sort of like marking their territory, right? Whenever you name something after yourself, it's like, well, this shall be known after me forever. But there is a certain time where things were described for the first time, and now these guys have it named after them. So Dr. Fitzpatrick was the chair of dermatology at Harvard Medical School. He was really a very prolific researcher. He is considered the father of modern academic dermatology, and he did a lot of the early research on melanoma or certain type of skin cancer and how UV exposure really affects your risk of developing melanoma. So he really did some groundbreaking research, and he categorized skin based on how it responds to light and radiation. It is still like the most commonly skin type system that is used, at least in this country. Now, I do understand that the criticism of the skin type system is that it is a very sort of Eurocentric skin type system, that it has a bias in it. And so I want to just make sure that I acknowledge that, and that there is an insufficient representation of global skin color diversity in the scale. Yet the reason that I explain it based on the scale to you is because it's still the most widely used system. And whenever we all categorize and train, that is what we're trained to categorize on, and that's what all the device companies use. So it is sort of the language that we use, and we know that language has bias, okay? So getting back to what the Fitzpatrick scale is. So basically, the Fitzpatrick scale ranges from type 1 to type 6, and each skin type has different characteristics. So type 1 is sort of that very, very fair skin. It always burns, it never tans. It's the lightest type of skin. So it's often associated with red hair, blonde hair, blue eyes. So any of you who have ever seen my daughter on any of my posts, social media, she is red hair, blue eyes, pale freckles. Emma Stone is a great celebrity example who I totally love. Prince Harry. So that is type 1. Now, type 2 is me. Fair skin usually burns, tans minimally. So often people have light colored eyes and lighter hair. So again, celebrity examples here are Jennifer Aniston, Reese Witherspoon. And then we have type 3. So type 3 is sort of like medium skin. It only sometimes burns, but it gradually tans to a light brown. So this is common among people that still are sort of classified as having white skin, but darker white skin. It's these beautiful golden undertones a lot of times are described, and Sandra Bullock is a great celebrity example of this. And then if any of you know my nurse injector Kayla, who's on my social media, she has a type sort of 3 skin as well. A lot of times brown eyes, brown hair, but doesn't have to be that. So when we go into type 4 skin, we are talking about beautiful, like olive type skin. So we have skin that rarely burns and tans easily to moderate brown. So these are common among people of like Mediterranean descent, Hispanic descent, Asian descent, right? So we have celebrity examples of Jessica Alba, Jennifer Lopez. They have just this gorgeous olive colored skin, or like beautiful sort of light brown skin. Lucy Liu, of course, is a celebrity example, and that will be type 4. So when we think about type 5 skin, we're talking about more browner skin now. It very, very rarely burns, but then tans very easily. And again, we have common among people of Middle Eastern, Latin America, or here's all where our Indian or sort of the neighboring countries' descent is. Some people of mixed skin are in this category as well. And celebrity examples are, of course, Mindy Kaling, again, beautiful Indian skin, Barack Obama, and people with similar skin types than them. And then we have type 6 skin. We have dark brown or black skin that sort of never or rarely burns. It's interesting because my friends that have that skin actually say, like, listen, we totally can burn, okay? And per the classification, though, it's like the fact that it never or rarely burns. You should still wear sunscreen no matter what your skin type is. And it is the most deeply pigmented skin on the scale. So we go from 1 very little pigment to 6 a lot of pigment. So of course this is very common among people of African American descent. And so celebrity examples, I mean, who doesn't know Oprah, right? And the supermodel Naomi Campbell, who's also just gorgeous, gorgeous, dark skin. So that is Fitzpatrick types 1 through 6. And let's talk about what the importance of the Fitzpatrick skin type in aesthetics is, and why really being cognizant of skin color does matter for, like I said, certain treatments and aesthetics. So number 1, it's really important to be cognizant of somebody's skin color, skin type to tailor treatments, right? Because different skin types respond differently to aesthetic treatments such as chemical peels, like we said, laser and light-based treatments, and certain types of microneedling. For example, we know that the darker skin types, such as 4 to 6, are more prone to hyperpigmentation and may require gentler treatments or specific lasers designed to minimize the risk of pigmentary changes. The other importance of knowing somebody's skin type is really risk assessment, right? So by understanding a patient's Fitzpatrick skin type and how their skin type may or may not respond to certain treatments will help your practitioner predict and really counsel the patient on the risk of side effects from that treatment, such as burns, scars, or post-inflammatory hyperpigmentation. And that is really important for the safety of your treatments, because we want to always do safety first, right? And safely administer treatments involving heat or light, such as laser hair removal, IPL, or other laser and light-based therapies. And then number 3 would really be customized skincare regimen. Different skin types have varying needs regarding sun protection and skincare. Patients with higher Fitzpatrick skin types may need different formulations to prevent dryness or irritation, versus those with lower types might need more robust sun protection due to their higher risk of sunburn and skin cancer. Now, everybody should always wear SPF, but of course, certain skin types are especially vulnerable for the dangers of UV radiation in terms of causing sunburns and skin damage. And then aesthetic outcomes, right? A lot of what we delivered is really outcomes based. So by knowing what treatments are safe for what skin types, we can, like I said earlier, sort of recommend treatments that are safe for your skin type to get you the outcomes that you want. For instance, achieving even skin tone and texture, right? Like most of us, no matter how light or dark our skin is, would love even skin tone and texture. But in different Fitzpatrick skin types, to get that result of even tone and texture will require different approaches, different treatments that will work, different treatments that are safe. And so that helps in tailoring the approach to set realistic expectations and achieving optimal results. Lastly, in medicine and aesthetics, we're already all about prevention education, right? And this is why I have the podcast. And this episode was really meant to educate about your skin type and also to help you understand that aesthetics, like medicine, like life, is not a one-size-fits-all approach. That if you can learn more about your skin type and how your skin responds to certain treatments, to certain chemicals, to UV radiation, you can get your best outcomes. You can have hopefully proper skincare. Of course, we want you to have proper sun protection, and we want you to prevent premature aging and skin cancers and really get the aesthetic outcomes that you want. So, does skincare matter in aesthetics? And again, it really depends on your treatment, but I would argue yes. It does matter because, like I have hopefully shown you, is that something like the Fitzpatrick Skin Type Scale, and there's other lesser known scales out there, they are critical tools for aesthetics because they help myself and other practitioners to provide safe, effective, personalized, and customized treatments so you, no matter your skin type, with every skin type and every subcategory in between, get the best outcomes. And that is really what I'm all about. So thank you for listening. I hope this was informative. And if there was something you would love to add to this episode, if you agree, disagree, I would love to hear it all. Until next time, stay safe, wear your sunscreen no matter your skin type. Bye.
Thank you for listening to the Aesthetic Doctor podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.